How to find healthcare step-by-step walkthrough tutorial and to help you retire early to save time and money.
Yeah, as a financial planner and tax strategist myself here for almost 10 years, we don't want healthcare to be the unknown reason on why you can't retire earlier. We don't want you to have to wait for Medicare. We don't have to have you wait for Social Security benefits to kick in. We want you to know that if you're in your 40s or if you're in your 50s, how you can find healthcare in an easy way with our step-by-step screen sharing guide to help you save time and years and money as well.
So we're going to go ahead and get started. So you're going to have your browser open, and when you're there, you are going to want to go to healthcare.gov. So healthcare.gov. Once you're on that main screen, you're going to go ahead and on the right-hand side, you will find browse plans and costs.
Okay, we're going to give you a few seconds for that to load up for yourself here.
Now, once you click that browse plan and cost, the next screen that you will come to is the See plans and prices. So what you're going to go ahead and do at the bottom is you're going to enter your zip code and choose your location and then press continue. On the right-hand side, you will then see the preview 2025 plans and prices, and you're going to tell us about your household and click start.
Give you a few seconds for it to pop up for yourself.
Once you click start, you're going to come to this screen. Are you enrolled in a 2024 Marketplace health plan? And you're going to click skip. Now, for purposes of this tutorial, we are going to do it as a married couple. So who's in your household? You're going to click you and other people if you are married and press continue. Now, the next screen, it will say, are you married? You're going to say yes or no. For this, again, we're going to click yes and press continue. Once you press continue, you're going to find, will you claim any dependents on your federal tax return? So for this purpose, we're going to just say no dependents.
You want to hit continue. Then we'll load up the next screen to come up here. Now, on this next screen, it is the tell us about you or yourself. This is a very important screen. We can do a number of parameters. Now, for this purpose only in this tutorial, we're going to have on the far left there, top left corner in the red box, age 51. We're going to go ahead and choose male and select any of these that apply to you. We're going to say none of these and check that box. And then we're going to hit continue. Now, the next screen you're going to see that comes up on the right-hand side is the tell us about your spouse. Now, in this example, we're going to put the age of the spouse is age 50. We're going to go ahead and select female or select any of these that apply to your spouse. We're going to hit none of these, and we're going to go ahead and hit the continue button. Now, of course, you can choose various ages depending on your age. You can estimate when you might want to retire earlier, or you can see any ages out there. We'll come back to this later in this tutorial to show you how you can easily edit or modify these. Now, the next screen you're going to see is confirm your household members on the top left, and you're going to go ahead and hit confirm. And then the next screen you will see is, what do you think your household income will be in 2025? Now, there's a great button on there in blue. It says, see how to estimate your 2025 income. It gives you lots of ideas and suggestions. And there are actual tax planning strategies around this to help you get a lower income with a higher cash flow so you could possibly get discounts, which we'll show you here in this tutorial as well. But for these purposes, we're going to estimate $50,000 in taxable income. We're going to go ahead and hit continue. And again, later on, we're going to show you how you can easily adjust and modify the income level to see various plan options and pricings. Now, on the next screen here, we're going to see in the top left corner, the estimated savings overview. Now, this is based on your age and the income we put in. They're estimating about $904 per month as an estimate you can save on healthcare cost. Now, what we're going to do is hit view plans. Now, once you hit view plans, you get a little pop-up box that comes up, you see in the top right, and they always have it as bronze, silver, and gold. Of course, bronze being the lowest cost, gold being the highest cost, but of course, there are different healthcare additives you get to this: dental, vision, premiums, deductibles, and more. And you're going to go ahead and hit see all plans, and that box will now disappear. Now, once you hit see all plans, by default, it starts off with the lowest, or bronze first, then silver and gold. We're going to go ahead here in the top left-hand corner, hit add more filters. Now, once we click the add more filters button on here, what we're going to do is just select the gold options, just to see what the highest ones are that are available or that are out there, so you can know for yourself. Now, once you hit add more filters and you choose that gold option, as you can see in the bottom left, on this purposes only, we're going to go ahead and show you an example on here. This is the UHC Gold Advantage, $0 virtual urgent care, $3 tier, 2RX dental and vision, and they're looking at $462 and change. But that lets you already know, hey, I could add this into my potential cost on here for my monthly premiums into my financial plan. But what if, you ask? Well, what if you said, hey, I want to see what would happen if I changed my age, or my spouse's age, or both of our ages. I want to see what happens if I change that income level. Well, what we simply do is here on the very top left, they have the viewing plans for this group. We're going to go ahead and just choose that edit button, as you can see there in right. So click that edit button on there. Now, the edit button, it's going to allow you now to go ahead and confirm your household members. You're going to again see the ages, male and female. We're going to go ahead and hit confirm. However, now it will say, what do you think your household income will be in 2025? Well, as you remember, in this example, we had $50,000 in taxable income. We're now going to change that to $75,000 in taxable income. We're going to go ahead and hit continue. Give it a few moments here for the screen to pull up. But now it's going to show you that your estimated per month is that $582. And now you're going to see, as an example, that same plan we saw prior, that UHC Gold Advantage on there, it was roughly about 400 and change on the prior screen. But now with having $75,000 in combined income and not $50,000, that same plan cost about $784. So again, you can look through all these plans from the bronze to silver to gold, find a plan that works for you and your spouse. Look at what it all comes with on there, but now you can utilize that number in your own financial planning. Utilize that number in your own budget, in your own expenses. So that way, if you want to retire at 45 or at 52, or maybe you're not 58 years old, you could put that into a financial plan to see how it impacts your budget, your investments, and your savings and your assets without being unknown in here.
We hope that you have enjoyed this tutorial and found this information helpful so that you can review your own healthcare plans and costs so that you can retire early and save money.
Because as a financial planner myself and a tax strategist here and owner of Awaken Financial Designs, we love helping people retire early, which we have done so often, but you need to know the numbers. And healthcare is one of the biggest questions we always get. It doesn't have to be scary. You don't have to know unknowns. As you can see, it's free to do this. It's a total walkthrough on yourself. You can get your own numbers and your own projections. If you ever want to talk to us or have comments, feel free to comment below. We'd love to hear from you. And as always, have an amazing wonderful day.